But that's not sufficient. And this is this epidemic in Sweden that showed us how important environmental factors are. So the top line is kids less than 2, and then the next one is 2 to 15 and 5 to 15. And it was running along here, like in the 70s, and then in the 80s it went up like this, and they worked out what was going on, introduced guidelines and put it back down to here. Now, interestingly, it's starting to go up again in Sweden in this age group. And it's kids that were born in this time period now have a very high rate of continuing to get celiac disease. So these ones got it then. The ones that didn't get it then seem to be getting it more and more the older they get. And what happened is they had thickened up the formula in Sweden here with wheat flour, so because they thought it was the right thing to do. And so these kids were getting gluten early, and they found that they were not being breastfed, and then they were also getting GI infections. So you can see if they were getting a lot of flour and they had more than 3 GI infections, they were at risk for getting celiac disease. So you can understand why, and actually this provides information for what we advise people, that because they found that if you get gluten before 4 months or after 7 months for the first time, there's increased risk. And so they worked out that the kids that were most protected got a little bit of gluten while still being breastfed between 4 and 6 months. And that's what we're currently advising people who ask us about in that respect. The opinions differ in this, but this is what the Swedish are calling primary prevention. And so that's what we advocate. It may change in a few years. Now, none of us digest gluten properly. We didn't evolve to eat wheat. We evolved to eat meat and run away from where we got the meat. And only in the last 10,000 years has there been gluten available because of the domestication of grains, which allowed us to live in towns and villages and cities, etc. But when the gluten gets into, that's poorly digested, gets into the bowel wall, if you've got DQ2 or DQ8, you're at risk to get celiac disease. And our intestinal permeability is changing all the time. Like it varies with different foods, with alcohol. When you exercise, there's an increase in intestinal permeability. When you have a GI infection, there's an increase. So all of us are getting these foreign proteins delivered into the bowel wall, and it just happens that some people get celiac disease, and it happens that more people are getting celiac disease. So these poorly digested gluten fragments get in through the bowel wall and then react with the DQ2, DQ8, which is a protein on lymphocytes. But gluten is also toxic to the epithelium, and this may be important in gluten sensitivity that I'll get to. Now, we looked at one of the problems, and in the literature, is that people with celiac disease appear to just gain weight going on a gluten-free diet. But like in the bottom panel is the national data, which is NHANES, and in America, 40% of women have a normal weight, 30% are overweight, and 30% obese. We looked at 200 people seen in the Celiac Centre, and interestingly, only 15% were underweight. The bulk of people were normal. And contrary to everywhere else in the literature, people seen in the Celiac Centre, the underweight people gained weight and the overweight people lost weight. So it appears that expert nutritional counselling helps people with celiac disease, and this comes down to what I always tell patients is that there are two things about a gluten-free diet. One is what to avoid, and there are lists and lists, but the other is what to eat, because people don't know what to eat that's good for them. But the experts can help in that respect. Now, what about gluten sensitivity? You know, there are many people, like that's defined as symptomatic response to gluten withdrawal in the absence of celiac disease. So many people who like claim gluten sensitivity might have celiac disease. You know, they didn't get really evaluated. And really, gluten sensitivity exists. And we know about that from dermatitis herpetiformis, because we say, if you got DH, you got celiac disease. But 20% of people with DH have a normal intestinal biopsy, so they have a normal intestinal biopsy, but we say you got celiac disease. And so those people have a gluten sensitivity that's a very real thing. It causes DH, itching, great inconvenience. Now, a lot of that's related to the development of TTG3 antibodies. The TTG antibodies that we measure are against TTG2. TTG3 is in the skin. And then there are neurological syndromes that people respond to gluten-free diet, but they've got normal intestinal biopsies. But if you stain the biopsies for TTG antibodies, they've got celiac disease. And they can have an antibody to TTG6 that's in the brain, but develops in the bowel. So what about irritable bowel syndrome? So I've been doing work with a colleague in Chicago looking at family members. And so these are biopsies. So we looked at people who had biopsies. Some of them had symptoms, but they didn't have celiac disease. And we found that they're at risk, and they had negative TTG antibodies, but under the electron microscope, the villi looked destroyed. So currently, when someone has symptoms and has a normal biopsy, we say, well, you don't have celiac disease, right? You know, it's like gluten sensitivity, or it's in your head, or it's something. But if you look very closely, a lot of these people really have something. So I have come to believe in gluten sensitivity, even though it's very difficult to grasp something that we can't measure. So, you know, it looks like to have active celiac disease, you've got to have this tissue transglutaminase response in the lower part of the bowel, and then you've got to have the toxic part to the epithelium that's not related to TTG and not even related to having HLA DQ2 or DQ8. And people can have just the TTG response and no villus atrophy. And because we know that, as I mentioned, in DH and in the neuro syndromes, or they can just have IBS-like symptoms related to damage to the microvilli. And so this is probably some of the individuals with IBS and gluten sensitivity. And maybe there will be a test developed for this, and so people can be better defined. Now, there are a lot of questions, like why is celiac disease increasing? You know, the genes really can't be changing, except you can change them. There's this methylation of genes, but it's unlikely that the increase in celiac disease is changing genes. And why don't more people have it? If 40% of us or 30% of us who have DQ2 or DQ8 have the potential to have it, like why isn't it 3%? Well, it is becoming 3%, or why isn't it 10%, etc. And why do you have all these associations? Why is there increased malignancies? Why is there increased autoimmune disease? Some people question the validity of diagnosing all the people with silent celiac disease because, like, you know, they don't have complaints, so should you give them a disease? You know, and it's this whole question of screening. Like, people with celiac disease want to diagnose everyone else, and they're frustrated when the family members won't, like, give up their arm and the blood and get a disease. But you're going to someone and saying, you know, you feel well, but I want to give you a disease. And they've done these wonderful studies in Sweden in which they test all the school children, and they ask the kids to write like a couple of paragraphs about what it was like to be screened for a disease, and then if they got it, like what it was like, because we subject our children to anything and everything. They don't have any control, right? They try to exert it occasionally. And the kids, some of the responses were amazing. Like, some of them said, I think it's really great to find out because this is going to stop me from getting sick. But other kids said, like, I felt fine. I felt fine, yet they're telling me I'm sick. I don't understand this. So it raises a whole bunch of ethical issues. And then, like, what about gluten sensitivity? Maybe this will become a greater entity as more people are getting involved. Like, I think it's quite striking that within this country, people are now even looking at gluten sensitivity. You know, there's a lot of interest in celiac disease, not a lot when you compare it to other diseases. Like at Digestive Diseases Week, which is the biggest GI meeting in the world that was just on. It's a week, it was in Chicago this year. Like 50% of the abstracts submitted are on inflammatory bowel disease, right? It's a rare condition, not nearly as common as celiac disease, but it's a pharmaceutically driven disorder. What was fantastic is that the disease that had the biggest amount of growth of interest was celiac disease. So it's occurring in this country, but it's still lagging way, way behind.